Good morning. My name is Lori Crawford Milbrot, and I'm the MRS Site Manager for the Bay City office. Thank you so much for taking time out of your day to join us for this presentation. We hope you find this beneficial to you and your organization. Our presentation today is called Stronger Together, Michigan Works and MRS. And this is a panel discussion regarding how Michigan Works and MRS work together within Region 7B. There's a few housekeeping. There's a few housekeeping things that I'd like to mention. We thank you for your patience today, especially with technology. We've been having some issues already today. So thank you for your patience with that. The Zoom should default to live transcript, but if you can go to the live transcript button to either access or hide the subtitles, there's also an option to view the full transcript. There's a designated time for questions and answers at the end of the presentation by each speaker. We will also have opportunities to answer questions as we move through the presentation. To ask a question in the question and answer area, press the Q&A button at the bottom of the Zoom interface. Captioning is also available by pressing the CC button inside the Zoom application and choosing Show Subtitles. All right. We're going to start by having our panel of presenters introduce themselves. So we're going to start with Megan Jesse.
Hi, I'm Megan. I am with Michigan Rehabilitation Services. I am a vocational rehabilitation counselor in the Bay City office.
Thank you. Kathy?
Good morning. I'm Kathy Long. I am with Great Lakes Bay Michigan Works. I am primarily located out of our Bay City office as a career coach with our adult dislocated workers. I do also assist our out-of-school youth, and then I am also currently assisting individuals out of our Midland office through our adult and dislocated workers.
Thank you. Jennifer?
My name's Jennifer Wells. I work for Michigan Rehabilitation Services as a vocational counselor. My office is located in Midland, Michigan, and primarily work with the general adult caseload and community mental health.
Thank you, Jennifer. And George?
Good morning. My name is George Wright. I am a senior program manager with Great Lakes Bay Michigan Works. We're a 5-county region that consists of Gratiot, Isabella, Saginaw, Midland, and Bay. I oversee WIOA programs for adult dislocated worker and welfare reform programs in Midland and Bay counties, and I have been working with Great Lakes Bay Michigan Works in some capacity for 21 years.
Thanks, George. And last but not least, Corbett.
Hi, everyone. I'm Corbett Daring. I'm a vocational counselor with MRS, and I cover the Gladwin and Aranac areas.
Okay, thank you. So we're going to get started with our questions, and each panelist will have an opportunity to give their response. The first question, how does having a good relationship with MRS/Michigan Works benefit your organization and your community? Megan?
So personally, I think that having that good relationship between the two is ultimately going to provide as many resources possible to those in our community. That good relationship between the two of us helps us understand, from my end, what Michigan Works can provide, how I can complete referrals over to Michigan Works. So that way the customers that I'm working with are not only getting the services that we can provide, but if there's something that we're unable to do and Michigan Works can help with, they're getting as much assistance as possible to be successful.
And Kathy?
So I agree along with Megan very much. So I have found that by working together with MRS it allows us to provide comprehensive support and services to potential clients and to clients. So there are ways that we each of our organizations narrow in on services, so to speak. And so there are things that go outside of the scope of what I may be able to do in relation to a disability an individual has. And so having MRS there to partner with these individuals just allows them to have that full support to be successful.
Jennifer?
Similar to what everyone's already saying, is it just helps the customer when we have multiple resources available. Everyone has their specialty and know more about one area or the other. Sometimes I just even find just the problem solving or brainstorming, I'm co-located inside a Michigan Works building. So just getting another perspective is always helpful from all the individuals at Michigan Works. Also with regard to like community resources, sometimes with our specialties, we might not be able to help with employment services, but all of our professional knowledge, we're able to even refer out to other area resources between Disability Network or community mental health or any schools, trade schools. So all of the community members.
Okay. George?
So from my perspective, you need to have that working relationship amongst each organization. I have worked with Michigan Works in some capacity with MRS, whether it be a co-location or office visits. I think the one piece that we all need to make sure that we're all thinking about is economic mobility when it comes to helping out our job seekers and moving them in a path that helps them become successful. There's also the access to talent with coordination of services that we offer. So providing, maybe MRS is providing the training part of what we're doing, we're providing the job seeking aspect of that. Although some of the services look similar, they're different because we all specialize in different areas. Part of what we want to look at too is the inclusion and belongingness from our perspective on when making referrals. We want customers or job seekers to know that we care and that we have their best interest in mind. And we coordinate together with events like job fairs. We do host a very large event in the fall called My Career Quest Middle Michigan. And a lot of my friends from MRS attend and they volunteer their time to help because we support each other.
Thank you. Corbin?
Just to kind of expand on what everyone else said, I believe all of that is great. Some other additional things that we might get from the cooperation is insight to services that may be of interest to our customers, some things that MRS can offer that Michigan Works doesn't offer, and vice versa, as well as growing our customer base, so getting referrals from each other.
Thank you. Okay, are there any questions in the chat, Allison?
No.
Thank you. All right, question number 2. What are common misconceptions people have about MRS and Michigan Works? How can we communicate more effectively to combat these misconceptions? Megan?
One of the biggest misconceptions that I've noticed since working with Michigan Works is that customers believe they can't work with both MRS and Michigan Works at the same time. So just having that open communication right off the bat, that kind of like what a lot of us had said in the last question, is that they may be able to provide services that we can't, but we can also provide services and collaborate to provide ample amount of assistance to have that successful employment, whether one's providing that training and one is looking for that job search. But just letting the customers know that it is beneficial that they can work with both of us at the same time, and it is okay.
Okay, thank you. Kathy?
So one of the things that I have found as I present the opportunity to individuals I work with about MRS, they're one of several partner agencies that I always try to highlight with new clients. They often think, even as I'm explaining it, they often think that somebody has to have a disability that prevents them from work and or that they have to be receiving disability benefits. And so they often sometimes exclude themselves from thinking that they may be able to tap into those additional services because they don't fall into one of those categories. And I'm able to share with them, no, not at all. Those are actually things that help you be eligible potentially. And so you'll want to connect with MRS so that they can fully explore that with you. On our side, we often deal with the misconception of Michigan Works really being interconnected, just with unemployment benefits. And so it's not uncommon that individuals that walk through our doors are coming in because they filed a recent unemployment claim, and they really think that that's the limitation of our services, and they don't understand all of the other ways that we can connect with them with their job search needs and with their needs potentially for training. So for me, it's all about that communication, right? Making sure that from my first interactions with them, I'm presenting the services that we offer. But then again, I'm also in that first interaction highlighting that there are partner agencies that we work closely with in the community, and just making them aware of that. Because I know that sometimes individuals feel that there may be a stigma with their disability, or maybe because their disability is more hidden, they don't want to open up about it. But if it's what I always share with them, if it's impacting them in their day-to-day life and potentially their success in a work environment, I want them to have that additional support. It's there and available to them.
Thank you. Jennifer.
Similar to what Jesse had, or Megan had mentioned, sorry. A big misconception is that they can't have cases open with both agencies. That's the biggest barrier that we have initially. After some good communication and explanation of services, most individuals can see the value in both programs working collaboratively together. A unique situation for me with misconceptions is being co-located. A lot of individuals think that I am employed with Michigan Works versus Michigan Rehabilitation Services, or believe that both agencies are one and the same. So explaining to them that, sometimes they feel like they're doing a lot of extra paperwork, but trying to explain that we are two different entities. And although we try to minimize any additional paperwork they have to do, it's unfortunately sometimes part of the process. But we, again, try to minimize that with a good collaboration, trying to streamline it with good communication between the referral and myself, just so the customer doesn't feel, or job seeker doesn't feel like they're doing extra work.
Thank you. George.
Much like everybody else said, same thing. A lot of misconceptions between both of our organizations, and I think the important thing with the misconception is to correct it right away. Make sure everybody understands. If they're saying or feeling or thinking something that might not be accurate, just using a guiding voice and letting them know what's available to them. Like everybody else has said, we typically, because we're co-located in Midland, and then we now share a co-location near each other in Bay City, a lot of what we see is that they think we're the same, and that we use a one-size-fits-all approach, and we don't. We're the talent experts when it comes to helping individuals get to a point where they're work ready and that they themselves can get a job, where MRS helps pick up in the process if they need extra support that we can't provide. And we look at referrals whenever we can. In some cases, it's best to make a referral to MRS first. MRS may make a referral back to us when they're ready to work with us, or vice versa. It might be, we end up working together with the organization because the person needs support. So we just have to be able to communicate. We have to make sure that all staff is aware of what MRS offers, what Great Lakes Bay or Region 7B Michigan Works offer, so that we're all on the same page.
Thank you. And Corbett.
So I have a lot of the same areas that other people have. And in general, I think the biggest misconception is who we are and what organization we're with, as well as what services we provide. And I found the best way to address this is just communicating it in the first meeting with the customer, going over what services might be available through us and how we can help them get a job.
Okay. Thank you. Are there any questions in the chat, Allison?
We do, Lori. We have a question. Are you working with employment networks in your area for long-term employment support services for your clients whose cases have been closed?
Does anyone want to jump in and answer that?
I'll jump in a little bit. To my knowledge, at least in our general area, especially Midland, there aren't many employment networks, ENs available. I mean, if we're talking about the Ticket to Work long-term supports. So MRS is the employment network kind of go-to option here. So unfortunately, there's some limited options if that was the question being asked. I'm not sure.
And from Great Lakes Bay perspective, our labor exchange is mytalent.org, where job postings around the state are posted there. They take very seriously what gets posted on there versus maybe other websites that are out there that you may get text messages from that may not be as secure. Anybody and everyone can use the front end of our services, and they can you can have a less than a high school diploma, or you can have a PhD and still come in and use those services. There are extra layers of services for individuals that come through that eligibility is determined. Ideally, when it comes to supportive services, that's during the life of the case or during the life of the individual working with us until they find employment. We typically try to engage every job seeker with all the job fairs, whether it be a single company job fair at one of our locations in our service centers, or if it's throughout the Great Lakes Bay region, so that everybody who's seeking work knows where they can go for work.
Okay. Anything else? Any other questions, Allison?
No.
Okay. The next question. If someone wanted to develop or improve their relationship with Michigan Works or MRS, where should they start? Megan?
So for me, I'm actually a newer counselor working with Michigan Works. And one thing that worked great for us is having those in-person introductions versus, sending out an email saying, I could be the point of contact. I felt like having an in-person introduction, everyone from Michigan Works can put a face to a name, and vice versa. Being able to kind of create a better connection with them. I felt like that confidence to send referrals my way and vice versa. Like I said, you know exactly who you're talking to, who you're working with, and can, like I said, create a better connection that way versus just sending out an email and not really knowing where that's going. So face-to-face connections for sure have seemed to work best from our end so far.
Perfect. Thank you. Kathy?
I would very much second what Megan says, having that direct contact. So it's great to have a partner agency, but again, if you feel like you're doing a blind referral, it doesn't give you confidence. You're not able to, communicate that confidence with the individuals that you're trying to refer. So for me to be able to meet Megan one-on-one and meet Jennifer one-on-one and talk with them and just get to know them a little bit on a professional and personal level has been huge for then me being able to also, when I'm referring clients, saying, this is the individual that you will most likely be hearing from and that will probably be working with you moving forward, so that they immediately have a name, not just an organization name. They know an individual is going to be there on the other end, ready to assist them, ready to help them navigate. Because similar to what Jennifer had said in a different question, each of our agencies do function a little bit differently in how we have to determine whether they're eligible for services. So we don't want them to feel exhausted and drained and frustrated through that process. So for them to be able to know, hey, I'm going to be able to connect you with Jennifer over in Midland, and she is going to be working with you through their processes, makes all the difference. And rather than kind of getting a maybe bristled response of like, oh, another agency, they feel already connected with an individual. And that's huge for the difference in whether they're even interested in exploring that referral and that additional support, or whether they're just like, you know what, no thanks, I'm here, I don't want to do anything more.
Thank you. Jennifer?
The direct communication is, I think, the biggest piece of the puzzle. And again, just the connection. So knowing each other. So not only when I get a referral from somebody, I can reference Kathy. They know that we know each other. They know that we're working collaboratively. It's not as if when I speak about the individuals from Michigan Works, the other employees, that I don't know who they are, or maybe that I have seen them here. So that has worked wonderfully. Also, Kathy's been great at giving referrals for some training programs. But I have worked really hard at the front desk, the first line of defense, as they come into the front door here at Michigan Works. So getting just an open communication there that they know I'm always available. So if they have an individual that they think might need some extra help, they can feel free to call me directly. I will, if I'm not in a meeting, I will immediately be available to help address any needs, help with any, referral sources. And also, bothering the supervisors too, kind of always being there, kind of a little pest. So talking to all of them, letting them know I'm here, letting them know I'm available. And not only letting them know that, but following up and making sure that it's, my actions speak. If they need something, I am present and available. And that has worked out wonderfully. Here, I get a lot of referrals and a lot of support from Michigan Works to help me do my job and help my customers succeed.
Thank you. George.
So to look at what we do, because we've already have those developed relationships that have taken years and decades to work on, and there's always process improvement on what we can do for somebody who is looking to develop or improve, which I think is what you asked, is you need to have engagement with your local MRS offices. So some MRS and Michigan Works staff are not co-located. There's not a 1 day a week that individuals visit. I really do think it's up to management and staff to kind of step in and say, let me see where our holes are at, and let's see what we can do to tie in some loose ends and work together. So you have to have some type of engagement first from MRS. You need to do your research on the services. So whether or not they come in and they do a virtual meeting with you like this, or if they come to the office and they do a meeting for all staff, and we've had that multiple times in the Great Lakes Bay region. That way we're aware of support like hearing aids and sleep apnea machines to help support somebody for their job, or individuals who need support to go back to work. Identify common goals that you have and seek out partnership opportunities. I say this all the time about job fairs. We can't do this by ourselves. We work together on the Great Lakes Bay Job Fair, as well as the volunteers that my friends at MRS send over, because they're all my friends for my Career Quest Middle Michigan.
Thank you, George. And I have to say, in Saginaw Bay City, before we were so close, we would have one of our counselors in their office. Thank you for the space to kind of grow that communication. Corbin?
Something that I could add to that is I've noticed that as my relationship develops with the Michigan Works out in Gladwin and Aranac, it's developed a lot from understanding the processes of that location. So knowing how they make referrals to their career advisors, and then them knowing as well how to make referral to me and what that process looks like.
Thank you. Allison, I understand there's a question and some comments.
We do. So the comment, great info on the collaboration between our organizations and how we can go further when we go together. And MRS also collaborates with the Michigan Works Business Service Team across the state to coordinate with the business community for talent opportunities. And then our question, is it possible to come up with a uniform referral form that also gives a limited release?
So regionally, we've worked, I think, with Carrie, and my guess is Allison and Lori probably had some input with a release that we use, but it'd be great that it would be something statewide, so everybody's using something very familiar and similar.
Yeah. And as with MRS, would be a decision that would come from our executive team in Lansing. So wouldn't that be nice though? All right, any other-
I'm gonna add to that though. So just to add, just from the field perspective, we did have, I think regionally or district, they had developed a referral. And it did have releases or signatures that they could sign for tracking the referrals and for releases. But when that was done so early at the front end, my referrals went to 0 for months, and I couldn't figure out why I suddenly went to no referrals, and then found out it was because we were implementing that they thought was a mandatory thing, and it wasn't mandatory. So that kind of, I think, just be cautious in the approach. So the new approach we kind of use here is that it's more informal for the initial referral. We don't want to scare off anyone to be referred. However, if we know it's a training referral, I do believe those releases are signed right away by Michigan Works End. Then I know immediately when I get the case that I'm immediately having them sign a release for Michigan Works. So during the intake appointment, the releases for Michigan Works are immediately signed during that meeting. But just a word of caution at the field level that when it became too formal, it did scare off some of our individuals who just didn't understand what the rationale for all those signatures, just to get additional help.
Great, thank you. Okay, the next question. How do you maintain your relationship when there's staff turnover? And I'm just going to ask the panelists if we can just, we're running behind a little, so shorten up our answers. Thank you. Megan.
Thankfully for me being newer, I have not had to deal with any staff turnover yet, but kind of similar to the question prior, if and when I do have to handle that, again, having those personal introductions in person, keeping that open communication right off the bat, and just explaining the services that we provide and can collaborate with Michigan Works on.
Thank you. Kathy.
Yes, absolutely. I can second that. I haven't had to go through that directly. Jennifer and Megan have been the two main ones that I've worked with all along, and so I haven't had to do that. But again, I would say that direct contact, that direct communication, establishing that relationship, counselor to counselor is so important to be able to provide that fluid, assistance to customers so that they don't feel like they're bogged down in a system.
Thank you. Jennifer.
Yes, I'm a little bit older, so there's been staff turnover. What has, again, direct contact as soon as you meet or get to meet the new person. There's always differences in personalities. For the most part, there's been no concerns. I think I've only had a concern very few times, and I immediately reached out to George, who helped facilitate. It's always about communication and education. So just reaching out for the extra support from the managers and supervisors is necessary when needed.
Thank you. George.
All right, I'll stick to my notes. So regular and consistent and continuous communication. We do things a little bit differently in our offices because we do feel like our MRS staff are our family. So we do a lot of invitations to potlucks, or we invite them to staff meetings. We do a meet and greet. We did one for Bay County or Bay City here, which I thought was amazing. And I also, when I do employee plans for new hires, I make it mandatory that they meet with the MRS staff in the building. They have to meet with every staff and become familiar with all the different avenues of support that's available.
Thank you. Corbett.
I think two of the biggest things I noticed were a good handoff when there's somebody new. So being able to introduce them to the different people, as long as that's available, and then knowing multiple people at the location. So being able to reach out to that manager to get introductions to the new staff.
Thank you. Allison, any questions in the chat?
We do have one. How long should it take to be contacted by your counselor from the time you submit your application? 2 weeks out, I only have a link.
Jennifer, do you want to handle that question?
An application was, I guess I don't quite understand. If an application has already been sent to MRS, you should receive a response. I mean, I typically respond to applications within 24 to 48 hours business time. If anything's gone beyond that, that would make me question if it had been received by the proper office. So I would encourage them to follow up with a phone call to the office, and we'd be happy to help you.
Okay, thank you. All right.
Sorry, Lori, we just had one more
Sure.
question come in. Not all Michigan Works offices provide the same menu of services since they are private nonprofit organizations. Can you give us more information about how Michigan Works is structured in Michigan? I know this setup is unique in the country with one other state piloting like Michigan is.
We actually have that coming up, I think, in one of our questions that we'll touch on a little bit more.
Yes, thank you, Kathy.
So I'm not gonna fully answer it right now, but I did want to piggyback off of what Jennifer said with the last one. And I apologize. Can you reread that question? Because there was something I wanted to be able to add to it.
The last question.
The question before
Okay.
that Jennifer had spoken to. Nope, maybe we can't go back
We-
to it.
That was
We
how
may-
long.
We're not able to go back. Sorry.
Okay.
Yeah, it was how
They're
long.
deleted as we go forward.
Gotcha. Okay. So yes, that response time has been key as part of this partnership. I do always let individuals that I'm talking with know if a week has gone by, please reach back out to me because that would be very unusual. While I don't know when MRS may have a day out of the office or vacations, and so I do preface that for them saying, you know, please understand, I don't know, emergencies can happen, those kinds of things, but typically you'll hear something within a day, maybe 2 business days. But to let them know if a full week has gone by, please don't just sit on that. I need you to let me know because otherwise I can't reach back out and say, hey, did you not get the email? Have you been out of the office? Is there maybe somebody else I
Sure,
could connect them
sure.
with temporarily? So that's really key.
Thank you. All right, the next question. What is your referral process between MRS and Michigan Works? So Megan.
So far, what has worked really well for us in Bay City, thankfully, like we said, kind of moving next door now, if the customer is open and willing, the referral process could be walking them over that day, and having face-to-face meetings between the 3 of us, or introductions at least. Of course, if they're not open to that or don't have time for that, from my understanding, keeping it open to the customer, whether that's providing my information and letting them kind of think on whether they want to work with MRS or not, and being able to contact us when the time is right for them, or
Thank you.
getting an email from Michigan Works to complete that referral.
All right, thank you. Kathy.
Yes, absolutely. It has been so beneficial to me that we actually have some flexibility locally. We aren't necessarily restricted to certain types of documents in the beginning. We are able to do some informal referrals. Like Megan said, there are customers that sometimes the best approach and that I'm able to offer them is, would you like me to walk you over to their office? You can see where they are. You might be able to meet a staff member there right away. And for some people, that is absolutely that maybe courage factor that they need because they're intimidated, they're scared, they're not sure. And so being able to connect to them immediately is huge. But then again, I always offer, like Megan said, would you like me to provide your information to MRS? Would you like their information for you to contact? Letting them have options to do it in the way that's right for them at the right time is huge.
Thank you. Jennifer.
Similar, it's informal, so I'm available for in-person just to explain our services if I'm available. Otherwise, make sure I have business cards available. We can just get their name, address, contact information, and I will contact them as soon as I return to the office if I'm not available. So I try to keep it more informal, but extremely quick response times is what's been working here.
Okay, thank you. George, do you have anything different to add to?
Yeah, just real
Kathy
quick.
and-
Yeah, each office looks a little bit different. So encrypted emails, mostly everything we do is informal. Faxes when necessary if we need to fax something over. Co-location we talked about when we walk things over. And then just making sure that we can do what we can and connect them where they're at. So I have connected on multiple occasions. I think my first time meeting Corbett was when I was at a job fair and somebody disclosed some information they needed some support, and I just walked them over to Corbett. I think Rob Riley, who was at the event, so that MRS could be promptly involved in helping that individual.
Thank you. Corbett, anything, any new information to add?
No, it really looks very similar. It's
Okay.
either an informal process of just email, letting me know by phone or in person.
Okay, perfect. All right, we're going to save the rest of the questions for the end. So thank you for your patience with that. The next question for the panel is, do all Michigan Works service centers provide the same services and support the same training opportunities? So this question really is just for our Michigan Works individuals. So Kathy, do you want to start?
I would love to. So the easy answer is not necessarily. So the main program that I'm a part of, WIOA, is a federally funded program. However, each state, it looks a little bit different. And then it's further broken, like George had mentioned before, down into regions within the state of Michigan. So within our region, we have those 5 service centers that are interconnected in Bay, Saginaw, Midland, Gratiot, and Isabella counties. And that allows us to really look at what are the local needs, what are the high demand career fields in our area. The example I give to clients all the time is when you look at a state, even like Michigan, what are high demand careers here aren't necessarily the same in Lansing or Grand Rapids or different areas. So we do have some local ability to really take a look at things as they need to be for our areas. That can also make it tricky because sometimes we do have individuals that move to a different region. So then it's trying to help connect them with a local Michigan Works in that area that can further walk them through. I don't try to speak for somebody else's or different regions because there can be idiosyncrasies that are different. Overall, offerings may look very similar, but how they happen could look very different.
Okay. George, anything to add to that?
Yeah, so the only thing is we are one of 16 different Michigan Works regions throughout the state of Michigan. So Saginaw, Midland, and Bay, Gratiot, Isabella. Although the size of the service centers look different, many of the services that we offer are very, very similar. When it comes to training opportunities, we follow a occupation and demand list that all 5 of us use. And then we have to look at whether or not there is an eligible training provider that we have to go to a list to look at to see if we can actually fund training like that. So our list, which is quite comprehensive, might look different than maybe our neighbors to the north in Region 7B or maybe those in GST and the Thumb. And each region has a different training amount that they may or may not cover. So there is a difference in how services are delivered. Training for occupations in demand will look different based on that regional need.
Okay, thank you. On to the next question. Can you provide an example of a specific experience you had working with MRS or Michigan Works that benefited a customer? Please include examples of how you coordinated services and funding between agencies. Megan?
So again, going back to being newer, we're still kind of working through many cases. But one case, for example, that we have been able to collaborate on or trying to collaborate on for funding is a customer that's trying to go through CDL training. So being able to kind of work closely with Kathy, trying to include the customer and, what can Michigan Works help provide for that customer? And then, where can MRS step in as well to provide as many sources for that customer to be successful in that training.
Thank you. Kathy?
Absolutely. Training's been the number one thing that I can say that collaboration is where I've seen it be most successful, especially on the client's end, right? If they're wanting to pursue a training, what does that look like? What's appropriate for them? I so appreciate when MRS can provide additional feedback in ways and levels that I can't take a look at because of where they focus in on. And so that's huge, making sure that we're providing services that are appropriate for that individual. And then again, that comprehensive support. Training costs can be so expensive, and just the time and everything put into it. We want to make sure they're set up for success. So to be able to do that together can mean all the difference with whether they kind of get through it, or can they do it with, just feeling all the confidence.
Okay, thank you. Jennifer.
To talk beyond the training, sometimes we have job seekers who come in just doing job search, and during their job search time, they may disclose difficulties with learning, but maybe something that's never been diagnosed, but just an overall general sense of something's going on. Those type of referrals, then we can help out with assessments, doing the formal testing, find out what the disability is. Sometimes that provides the job seeker more understanding of what's going on, why they've struggled with maintaining employment or keeping employment. So then also maybe targeting the job search on more appropriate jobs based upon whatever type of disability they might have. Also, maybe not exactly funding, but using the other resources that are available through Michigan Works, their resume workshops, their obviously the job seeking end, and all of the other workshops that are available. So it's not just training, there's lots of services we can coordinate together between our agencies.
Thank you. George.
I can be long-winded, Lori, so I will keep it to my notes. So
Thank you.
we have an individual who I know we served in Bay County that went through, I believe, an RN training program that needed a special stethoscope that we weren't aware of. That is something that MRS was able to participate in. We make referrals a lot of times for individuals who come in who are currently working that need hearing aids, or people who need to work, but they have, a hearing deficit and need to get a hearing aid. We've made referrals for people who need sleep apnea machines. And those all come, whether they're coming in from the front door to they're attending a job fair. And I often find myself carrying on random conversations with people in the line at the grocery store, selling everything that we do and any of the partner agencies do.
Thank you. Corbett.
So being relatively new myself, I've only had a few cases where we've kind of worked together, and all of them have been CDL cases. So those were really invaluable, having both organizations. We were able to help identify additional resources that MRS could provide that the customer couldn't provide themselves, and that Michigan Works didn't provide, as well as helping the customer kind of walk through the step by step of getting to that employment ready status.
Thank you so much. Okay, the last question for the panel. What advice or suggestions do you have for developing a successful partnership between MRS and Michigan Works? Megan?
As we've mentioned a lot through this panel, I think communication is the biggest key to that partnership, but also being asking a ton of questions and understanding what the other entity can provide for our customers, having a big understanding, and I'm learning still every day on what they can help our customers with, like I said, to have that successful employment in the end.
Thank you. Kathy?
Absolutely. I've been able to benefit from those relationships already being established between our agencies here locally. But again, that yes, getting to meet the boots on the ground on the other side, getting to know Megan, getting to know Jennifer, so that we can collaborate with making sure that we are effectively, getting referrals back and forth, effectively addressing concerns or needs that come up. That is just so important for it to be continued success all along the way.
All right. Jennifer?
It's been mentioned already, but being a physical presence, just being here, talking to our coworkers, and as George puts it, our friends at Michigan Works. It's not just I come into my office and shut the door and we're separate. We're together, reaching out, and it's more of a friendship and a collaboration, and we know each other. So that's what's been working best.
Right. Thank you. George?
Yeah, all of my friends with MRS, I know about kids and family members and dogs. So, it is a friendship because they are co-located or come to the office enough where we know enough about each other, because we all want ourselves to succeed, but we also want the economic mobility of the job seeker to be successful. So one, don't wait. You know, if you are noticing that you don't have that relationship, you need to reach out. You have to build trust and rapport with Michigan Rehabilitation Services, as well as Michigan Works. You're going to have some type of continuous communication plan. Whether that be they come to staff meetings, you go to their meetings, you make presentations together, got to share resources with each other. So, you know, there's no secret when it comes to resources. We all should be sharing them. We celebrate successes and wins together. Establish any types of agreements that you have with each other, and then at the end of it, it's review and revise. So it's basically evaluate and adjust, you know, where you need to make sure that everything's moving forward.
All right, thanks. And Corbett.
I think everybody else kind of gave a really comprehensive review of this. The one thing I would just say is building our relationships between each other individually will help us build the relationships in the organization.
Thank you. All right, Allison, I see there are some questions in the chat.
We do. We have a comment. This is McKellen Saginaw. I just wanted to say thank you to Michigan Works staff in Saginaw for their office space and collaboration on referrals and resources. I have noticed increased referrals from various staff members, which has been very positive, both youth and adult. Thank you. And then we have a question. Is there a written source, website brochures, etc., for what Michigan Works trainings are offered and what the eligibility criteria is?
George, you want to take that question?
Yeah, so every office in every region is going to be a little bit different. I know that a lot of people want to come in a little bit more prepared. I always say it's best just to stop in, because we look at what best fits the individual. So somebody might not be eligible for WIOA services for a variety of reasons, but there might be other avenues to help that individual out. So I would recommend that you come in. You know, we are michiganworks.com. Again, our region is Saginaw, the Bay, Gratiot, Isabella. We traditionally put in the job seeker section of our website the occupation and demand list that's out there. Again, they do get updated on an annual basis, but I would just stop into your local Michigan Works office, inquire about training opportunities, and then ask to speak to a career coach or a staff member to help guide you along, because we want to help you where you're at. And again, we're one of 16 different regions, and every region has a different list.
Thank you. Next question, Allison.
The next question, are we able to connect with the speakers if we have questions, emails, or phone numbers? I've actually am going to put them in the chat. So I've got the district Michigan Rehabilitation phone numbers in there for our offices, and then the Michigan Works mainline number and their information email. So I'll put that in.
Okay.
And the next question, is there information available for WIOA services?
George, back to you.
Yeah, so the website is going to be very bare, you know, on what's available for WIOA services, because, you know, depending on whether you're an adult, part of the general population, a dislocated worker, whether you're in school youth or out of school youth, you know, there are general acknowledgements that you can look at. I think the best thing to do is either call or come in. I think we need to come in. We need to have that conversation. You know, if you're working, we have to look at family income. So there's just a lot of if this, then that. And the eligibility looks different for just about everybody. So it's not a one size fits all approach.
Thank you. Allison, next question.
The last question, are there any opportunities for local neighborhood organizations to develop a partnership with Michigan Works or MRS?
So I just had a meeting with the United Way of Bay County today, which I thought was super successful. And I think every organization that's out there really needs to be working together, because at some point we all need to understand what everybody's doing to know where support is at. So yes, there's always an opportunity for that.
And I would say if you have that interest and you want to see how we might be able to partner up, reach out to one of the managers, reach out to George, so we can sit down and have a discussion. All right, so that was all of the questions. Before we wrap it up, are there any other questions, or is there anything else anyone from the panel would like to add as we wrap things up?
What I would add from the career coach perspective at Michigan Works, again, no, we don't really spell out eligibility requirements or all the specifics of each program. I 100% second what George says. We want to get you connected with a live person that can talk through. Every scenario is different. So while that can sound frustrating, we really need to talk with you, and we really need to understand who you are and what your situation is, what your family situation is, what are you trying to accomplish, because it's not a one size fits all. And so I may be able to work with somebody through one avenue, but they don't qualify in a different way. And so really being able to connect to determine what is appropriate for them. And that's also where we get the opportunity then to know, do we need to refer them to MRS? Do we need to refer them to another community agency? That's really how we find out and connect them with the most appropriate services. So the other thing is, we don't want it to be daunting. It can feel very daunting whenever you're working with an agency that receives federal funding, because that means there's going to be paperwork, right? And so to help them know that there's going to be an individual navigating that for them and with them can make it feel less intimidating and less likely like they're just not going to do it.
Okay. We have another question in the chat. Someone wanting to know how to reach out to George, how to contact him. Again, Allison is going to be putting those in the chat, the contact information, email addresses for everyone. Okay.
We have, sorry, one last question that just came in. Do either
Okay.
organizations face any barriers with wanting to partner together, but having the pressure to use your own agency's funding to provide services, AKA use comparable benefits through a partner agency, but told to use ICTA funds per MRS? If so, what strategies do you use to navigate this?
A really good question. I'll talk about Michigan Works. And I'm sure MRS is similar. I mean, we're last dollar, lastest dollar, right, when it comes to spending. So we always have to look at other avenues when it comes to that. But when you have two agencies coming together to work together, we honestly do work together to make sure that you are utilizing what's best for you at your specific time and what we can fund. So we do work together. Again, every single case is different. So to generalize something into into such a general question, everybody's situation is different, but please know that Michigan Works and MRS looks out specifically for every job seeker that we're serving to make sure that we're doing what's best for them.
And I know from at least the offices I oversee, many times that's a conversation. And what can you provide? What can we provide? And how can we blend these services to meet the needs of the individual we're serving? All right. Any last questions that you can see, Allison?
Just a comment. Thanks for the info. Very helpful.
Okay, great. Well, I want to thank everyone for joining us today and participating with your questions. If you have any questions, please don't hesitate to reach any of us. I think we can all confirm that we are so pleased and happy with the relationship that we have built with each other here in Mid-Michigan, that we would love to see it in everyone's regions. So please don't hesitate to let us know how we can help you achieve what we've achieved here. All right. Thanks again. Thank you to the panel for your help with putting on this presentation.